So I'm Shaye McIntyre. I work at the Permian Basin Rehab Center. I am a speech therapist, but I'm also the clinic director there. So we have physical therapy, speech therapy, occupational therapy, and audiology. So I'm just going to start with 12 months of age. Usually if there's a speech issue under 12 months of age, it's feeding, swallowing, something like that. So 12 months of age is when we start to see the first words come in. We expect to see maybe 3 to 4 words at 12 months of age, other than mama or dada. That's what we call reduplicated babbling, where they're repeating the same syllable over and over. So mama, dada, 3 to 4 words in addition to that. At 12 months of age, your kids should be recognizing their name when called. They should relate words to objects. So if you were to say cat, they might respond with meow. So they understand that that word has meaning and it's attached to a type of object. From there, you go to 2 years of age, and it jumps drastically, so the vocabulary should be about 200 words. Obviously, some are going to have more, some are going to have less. It's okay, but that's average. There should be short phrases, sentences being used, 2 to 3 word phrases or sentences. They should be able to follow simple directions like get the ball and take it to dad. If it's vocabulary that they know, they should be able to follow the direction. Let's see. At 3 years of age, it jumps drastically. It goes from about 200 words to about 1,000 words that they're using. We look at sentences of 3 to 4 words, sometimes 5 words. They should be following directions, but not simple directions. It should relate to prepositional phrases. So they should understand get the ball and give it to dad, but they should also understand get the ball, put it in the box, put it under the bed, in, out, on, under, that kind of stuff. Just very basic. Let's see. At 3 years, this is kind of tough too. It varies a little bit for boys versus girls. It's pretty common up until between ages 3 and 4 for boys to be a little bit lower than girls, especially if they aren't walking. So as I'm giving these milestones, keep in mind, boys might be a little bit behind, it's okay. If they aren't walking at 12 months, sometimes 16 months, we've got to let the walking come into play, let them get stable there, and then oftentimes the language will come flooding in. It's crazy how those two things relate, but they do. At 4 years of age, it should be non-stop chatter. They should be able to get ideas across, tell you very basically about their day, something exciting that happened, a variety of WH questions, so all the what's, when's, where's, who's even, and be able to answer your questions. So there's a steady progression in vocabulary and the amount of words they should use. There's a steady progression in the length of words in the sentences that they should use. And also in the questions that they're understanding and responding to. If a kiddo, a lot of things play in. Some parents call and their kids aren't talking at 12 months and they're worried. It is okay. If your baby was born early, then we have what we call adjusted age. So if they were born 2 months early, then at 12 months, they're really 10 months. So we're looking at what they would be doing at 10 months of age, which is just attention to the speaker, attention to objects, smiling, imitating facial expressions, things like that. So there's a lot of factors that play in. So again, don't panic if your kiddo's not doing these things. But these are guidelines where typically developing kids are within that threshold. At 3 is when we really start to look at speech sounds as well. So it's not just language development, it is speech development. So at 3 years old, we're starting to look more into intelligibility. That jargon should kind of go away. The not understanding what they're requesting tends to get better. We're understanding more of what they say rather than less. Some of the speech sounds for 3 years are what we call bilabials. And those are all of the sounds that you produce with your lips. So B's, P's, M's, all of those sounds. In addition to those sounds, the easier sounds that come in at that point would be like the W's, H, and F. And all of those sounds are either easy to make, or they can see you modeling those sounds and imitate those. So around 3 years old, much more language, speech sounds come into play. The best way to promote speech sounds is just getting them to imitate you. So if you have a kiddo who's really not intelligible, or they're talking but you aren't understanding a lot of the words that they're saying, work on just basic vocabulary, things you would use at home. Not only does it build language, but it builds the practice for the speech sounds. So as you're getting dressed in the mornings, talk about what you're putting on and get them to imitate at least the first sound of each object. When you're eating dinner, talk about what's on their plate. Describe the items, practice the sounds to say the items, and of course books. Books are fabulous. So books, language enriching, they're identifying objects from those busy pictures, so they're learning the vocabulary. You're asking lots of where questions, where's the ball, or what's under the chair. It's a fun way for them to look at the picture and identify your question and answer it without having to expressively do it. So that's a building block for expressive communication. And just practicing sounds. You know, if you have a kid who maybe they have siblings that speak for them and they just aren't talking that much, pick their favorite item. Put it up where they can see it but they can't get to it. It's something you know they'll want to work for. And make them, even if it's an attempt, it doesn't have to be perfect, but make them attempt to say the item before they get it. So I always tell parents it's easy for us to say that because we aren't there to deal with the meltdowns when they get frustrated, but the key is to not give in. So that's why we always say just pick one object, don't make it too frustrating for them, but pick an object that you know they're going to want and maybe you will be willing to speak for. For some kids it's snacks, for some kids it's toys, for some kids maybe it's the iPad, but get them to imitate. So if they see that up on the shelf and they can't get it and you say, oh, do you want it? Get them to either imitate the first sound of the word, if it's a really hard sound, like maybe it starts with an R, that's really hard for the younger kids, then maybe we just want them to say please, point to it and do the please. They can do the puh. But the key is that they're communicating to get what they want. And if they don't do it, don't give in and give it to them. Even if they get upset, just say, it's okay, I know it's hard, we'll try again later. And put it back up. And give them several chances throughout the day to do that. Usually they understand that they're not going to get it until they attempt it. So it doesn't have to be perfect, it doesn't have to be the whole word, it just has to be attempted communication. So those are good ways to elicit some speech sounds. From there, hopefully they get to where they do it all on their own and you don't have to put the item up. But from there you can either select a different item or add more items. But that's usually what I would say is the kickstart into them understanding I have to talk to get what I want, or at least attempt to talk. A lot of kids, and again I keep going back to the boys, I don't know what it is about boys, but I think girls just like to talk. And so they're talking and boys aren't. And that's okay. But those are just ways to elicit it at home. Hopefully keep it stress-free and make it fun for them. Anytime you can make it fun and engage them in language-rich environments, the better luck you're going to have. Oftentimes when patients come in for speech therapy, I think so many times they're shocked because they come in and they see all the toys we have out and it looks fun. It looks like we're playing, but it's structured play. We're talking about everything that's going on. We're talking about the animals and the sounds they make, maybe what they eat, how they feel, basic concepts. Are they big? Are they little? Do they have hair? Do they have feathers? The libraries are really good with the sensory books where you can touch, soft, furry, all of those descriptive terms that go along with some of these words. So if you have books that have the sensory aspect to the language aspect where they're seeing it, they're hearing it, they're understanding it, and now they feel what soft is, they feel what hard is, they feel what rough is. That's just much better learning environment for them when it's enriched with all of those things. So verbal, tactile, and the auditory, they tend to pick up on it quicker. I think oftentimes what people struggle with the most when they come in and they are doing language therapy and we give them homework to work on, they'll say, well, we get home and they don't want to do it. It's a struggle. We can't get them to sit down. And they are not used to having to do language activities at home. So that's where we go back to keep it fun. Use a visual timer. A lot of the smartphones now, you can download an app for a visual timer. Because it's one thing to say, like, it's going to be for 3 minutes. We're just going to do it for 3 minutes or 5 minutes. That means nothing to them. So if you can set that visual timer, they still don't know what 5 minutes is. But after the first time you do it, they see, oh, there's red here, and when that red disappears, we're done. So it makes it a little bit easier. The first few times you sit down and do that are probably still going to be a battle. But when they get used to it and they realize it's just for that short amount of time, and then they're done and they can go about their day and do whatever it was they were doing, they usually participate pretty well. They kind of get into the routine of it, the structure of it, and they do well. So if you have a little bitty kiddo, I would say 3 years and under, make it play. They don't have to sit there and do flashcards and drill and practice, but keep it fun, have structured play, where you're talking about everything that you're playing with, or even the sequence of events that you're doing while you're playing. If you can correlate a book or some kind of sensory aspect to it, that's great. And then about 4 years and up, if you're working on things at home or there's weaknesses that maybe you want to address, that's where that visual timer comes in, and it's much easier, and you get further by saying, oh, it's time to do some language, and they have that visual timer. They know what's expected of them. When they're done, they're done. But the key is to keep it short. You can always increase the time if you have a kiddo that's in kindergarten and you're really working on some homework from school as well as the language and other aspects. You can slowly increase that time. I would start with the structure of sitting and the visual timer, and then as they get that 5 minutes and they're participating and they're doing well, then maybe the next week it's 6 minutes, and maybe the next week it's 8 minutes. And you work it up to whatever time you want to work on it. But they usually fall into that structure. Any kind of visual aid you can use to help makes a huge difference, because like I said, especially if you have a language delayed child, to say we're going to sit down and we're going to work on this, they're hearing work and sit. They don't want any part of that. But when you have the visual aids to go with it, when they understand the consistency of it, you're always at the table, they're always sitting down, it's always with the visual timer, it makes life so much easier. And then as they get older and you really have schoolwork, you're already in that mode of we sit, we work, and here's the timer. A lot of kids don't have trouble with that. You won't have any issues at all, and you can play and keep it language rich. But some kids don't do as well. It's a hard task for them. It becomes task avoidance, and they just don't want to do it because it's hard. They don't have the confidence. It's just a struggle for them. And those are the kids where you really need to think about the structure, the time frame, what your expectations are, and how you can make it fun for them. As the kids get older, there are different speech sounds that come into play. We talked about at 3 years of age, there's bilabials, the B's, P's, M's, H's, W's, F's. But as they get older, there's other sounds that come in. A lot of the developmental charts show what we call the more difficult sounds like S, R, TH, and Z. Later, almost even into 7 and 8 years old. That's a guideline, but what we always say is if you have a kiddo that is really doing well language-wise, just has a few speech issues, maybe there are a few sounds they can't pronounce, don't wait until 7 or 8 to start working on some of those later sounds. If there's just a couple of sounds and they're 5, go ahead and start working on some of those later developing sounds, because there's a fine line between waiting until they're 8 because they weren't quite ready to work on those sounds. They had a lot of other things they were working on, and now you're breaking the habit of incorrect placement. When you could have started working on it at age 5, they were appropriate for it, they were able to get the concept of it, and you don't have 3 more years of habit that you're breaking. So speech and language, it all flows together. Those little developmental milestones hit about every 6 months to a year. So from 12 to 1, there's a lot that's happening, going from 2 to 3 words, or from 12 months to 2, I should say, not 12 to 1. 12 months to 2, you're going from 2 to 3 words to 200 words. I mean, that's a short amount of time to build that vocabulary. And then again, from 2 to 3, you're gone from 200 words to 1,000 words. So it starts to build very quickly, and the sooner you can enrich that language, read books to them, ask questions about the books, point out pictures in the books, build that vocabulary, the better off they're going to be as they reach that 3, 4, and 5-year stage, because 5 years is what's important. That's when they get to school. So if their vocabulary is weak, if they're having a difficult time following directions, school's going to be a little bit harder for them. It's going to be a rougher transition. So those are all things you can do early on to build language skills and speech skills. The main thing is just know there's lots of resources out there for you. You've got outpatient therapy services with therapists that you can call and visit with if you ever have questions. Your schools have resources as well. They all have speech therapists, physical therapists, occupational therapists, and you can call and talk to them at any time. They're under the special education umbrella. And then, of course, the library. That's where you find the most language-rich environment you can possibly get. But there are lots of little tricks you can do. So, you know, as your kid's getting older and you're concerned, or you aren't sure if you should be concerned, reach out to people and ask questions, and go to the library, spend time with the books, spend time in language-rich environments, and it makes a big difference.